Hi, my name is Tanja Hedberg. I have PCD and I'm involved in the Swedish Cystic Fibrosis Association, which also include PCD.
Hi, my name is Lotten Björk, and I work as a project leader in the Swedish Cystic Fibrosis Association. The project I work with is called Alone but Not Lonely, and I will present it now briefly in a PowerPoint. The aim for this project is to promote the mental health for people with PCD and CF and their families. And why this project? We have seen over the years that there is a need for personal support among our members. Many people have called our office phone with their concern. For those who's living with PCD, the worry and frustration is often about not getting access to the right care and not being taken seriously, and they feel alone in this situation. Since PCD and CF are progressive diseases, mental illness often comes in connection with a worsening. Then being able to talk to someone about how you are and how you feel can make everyday life easier. With this project, we want to promote mental health by offering individual conversations by trained volunteers, as well as creating online group meetings consisting of people in a similar situation that meet via video link in Zoom. Those who contact our helpline and chat often wants to talk about concerns about new therapies and shortcoming in healthcare, concerns about transplantation, anxiety and depression, and most callers are relatives. These are some of the groups going on right now. We only start groups that are demanded by our members and by healthcare. Each group has a maximum of 8 participants. We are recruiting volunteers during the project, and right now we have 8 volunteers. In November, we started the first training in call support. We also offer webinars on mental health.
I'm a volunteer in this project and I've listed some topics from conversations with people living with PCD and parents of children with PCD. One big issue in Sweden is the lack of knowledge and understanding about PCD among healthcare professionals. This causes stress and anxiety in people with PCD. Parents who have or had a baby in neonatal care often express feelings and symptoms of emotional and psychological trauma. Another topic that often comes up is about changes in emotional state and behavior prior to an exacerbation, and in some cases after. The changes involve anxiety, sadness, withdrawn behavior, and losing confidence. It's common to feel overwhelmed by many organs being affected and requiring attention and treatment all at once. People are frustrated and exhausted because of the symptom and treatment burden. Childless people often express grief and social exclusion, and many feel different compared to peers and have difficulties keeping up with peers. Many also experience lack of understanding about PCD symptoms in school and daycare and among peers. People with a severe disease need to talk about death and dying or about lung transplantation and its challenges. Many express hopelessness that there's no future with PCD, but I hope that this conference shows that there is a future. Thank you.
Thank you for listening and good luck with your conference.
Hello, everybody. I'm happy to read to you some sections from my autobiography, Prohibited, A Life with a Rare Disease, which was published as a book last year. The book is written in German. When I was 7 years old, I once again suffered from recurring infections. No doctor could help what to do. The mother had now found a children's sanatorium that was ideally suited for a long stay, the Pro Juventute Children's Sanatorium in Davos. There the children receive all-around care. It was not easy for her, the mother, to bring her eldest son there for such a long time. They had discussed all sorts of things, but unfortunately there was only one hope left. Up to the mountain when nothing else helps. The Alpine Sanatorium sounds like a banishment sentence. If you don't get better, we can't help but give you away into exile for sick children who can't be helped. In the next section, I describe the scene with the daily lying ritual in the wintry mountain air. This gave the title to my book. The customs and traditions of the tuberculosis era in Davos are still very present in the everyday life of the sanatoria in 1965. Thus, even in this children's sanatorium, lying in the fresh air under a woolen blanket is kind of sacred ritual. What is supposed to be good for the adults must still be right for the children years later. After lunch, every day, it's spit out time. This means that all the children are sent to the toilet to spit out any mucus. This doesn't work for Hansruedi. His bronchial tubes don't play along with the strict schedule. The mucus doesn't come out on command. After this procedure, the children may recover undisturbed in the healing mountain air. In their clothes, they all lie down under 1 or 2 woolen blankets. And from now on, it's no coughing, close your eyes, now it's time to sleep. This is a strict order, enforced with military discipline. Sister Mary lays herself down on one of the cots between the children, in a different place every day, and supervises the 2-hour lying ritual, immediately hissing at anyone who doesn't abide by the strict rules. For Hansruedi, this is a special ordeal. He has to pretend to be asleep, even though he can't hardly ever fall asleep during the never-ending 2 hours in the winter cold. And again, he has to suppress his urge to cough. He is strictly forbidden to cough, but his body rebels, especially in the first few minutes after lying down, when mucus often comes out of his bronchial tubes. Somehow he has to push the cough into the pillow inconspicuously and silently and swallow the mucus dutifully. His most common and everyday symptoms of illness are banished from the world for 2 hours by decree of the head nurse. So he learns a paradoxical lesson of the Davos regime. You must not be who you are, deny yourself. Day after day, the 7-year-old struggles through these hated 2 hours of military rest on the wintry cold veranda. After an interminable long time, it's finally 3 o'clock in the afternoon, and the ordeal comes to an end. The boy is allowed to get up again and move around and cough when his body demands it. When I was in elementary school, my health improved at times, but between 13 and 15 came the next health crisis. This time, the sea air should help, with a 6-month stay in Holland and England. I was still not diagnosed. After returning from abroad, I had to go to the Children's Hospital for a checkup again. Pension, no thanks. 3 weeks after returning from London, Hansruedi is due for a checkup at the Children's Hospital in Zurich. Accompanied by his mother, he is standing in a treatment room of the Children's Hospital with his upper body naked in front of the senior doctor, who examines him superficially. She says that the youngster has grown amazingly and pleasingly. She talks about this for quite a while, until the mother suggests that she is probably confusing him with a cousin who is short. That settles the issue of body growth. When the head doctor realizes which adolescent is standing in front of her, she wordlessly notes that his health condition is considerably better than at the last visit 6 months ago. Nevertheless, she suggests continuing the weekly posture exercises as well as the control visits. But she didn't reckon with the young man who has always been quite intolerant. I will no longer go to posture exercises. In the meantime, I have become acquainted with a method that helps me much better. That's what I'm continuing to attend lessons in the Alexander technique in the future and no more posture exercises. The doctor accepts the teenager's unexpected contradiction without any apparent reaction. Perhaps this patient has been mystery to her for a long time, without a clear diagnosis and with an obscure clinical picture. She learns from the mother that the adolescent is now re-entering grammar school. He could already do that, she says to the mother, but actually it's a futile effort because this young person will never be able to work and will live on a pension as an adult anyway. It's therefore not worth putting too much energy into school education. This blatantly expressed prognosis, which dismisses my further education efforts as superfluous and pointless, enrages me even more and provokes me my most vehement rejection. What does this doctor think of me, who knows me so badly that she mistook me for a cousin only a few minutes ago? I have finally freed myself from a 2-year crisis, and my health has recovered to some extent, and now this. I am not planning my life as a full-time pensioner. At first, I was shocked at my own courage. I have never experienced myself behaving like this. But apparently, I must have contradicted her so emphatically and convincingly that she doesn't even dare to insist and demand the continuation of the treatment in the Children's Hospital. I actually had to live to be 39 years old before I finally knew what diagnosis I'd been living with all my life. Here's the chapter when I first found out what I'm suffering from and heard the term primary ciliary dyskinesia for the first time in 1997. What a miracle, a diagnosis. The last 2 years have been a frustrating relay race from one doctor's office to the next. Getting satisfactory medical treatment is a difficult task with my ailment and without a diagnosis. Finally, I get a tip-off that a younger doctor has recently opened a practice where I could try my luck. The first appointment is promising. No long waiting, and the doctor has time and listened me in the detail. At the second appointment, he tells me that he has a hunch. There is a rare disease that fits my symptoms well and is associated with the male infertility. He suggested that I go to the ENT department of the University Clinic in Zurich to have this suspicion clarified. A few weeks later, I'm called to the University Hospital. Along with other procedures, Samples are taken from my nasal mucosa, which is a bit painful but not too terrible. 2 weeks later, I come to discuss the findings. My new doctor's suspicions have been confirmed. My chronic condition suddenly gets a name, a definition. Primary ciliary dyskinesia, PCD for short. Then I leave the university hospital complex. I'm traumatized with the enormity of what was just happened. I, the health hermit, the medical oddball, have just received a very concrete diagnosis. Is that humanly possible after so many years of uncertainty? How am I supposed to understand this? Does it really mean me? The amazement at the new reality with a concrete diagnosis is mixed with anger and incomprehension at my decades of wandering through the medical system of a wealthy country. How can it be that I have to be 39 years old before a doctor puts me on the path of the right diagnosis? How many doctors have seen me, examined me, and treated me in that time? Was it 40 or 50, maybe even 60? I can now discuss the next steps of treatment with my doctor. The bad news about my new diagnosis is that there is no cure for the consequences. It's no cure for the disease, no medication that leads to recovery. I can only keep the consequences, the symptoms in check, delay this decrease in lung capacity as long as possible. In the coming years, I succeed in significantly reducing the frequency of infections to about 1 to 3 per year. Some things now change fundamentally in my life. Suddenly, I can tell what specific ailment I have, why I cough, have a constant nasal flow, have a considerably reduced lung function, and short of breath. For so many years, there were a kind of marriage, my own personal Rumpelstiltskin. Thank you for your attention.
Hola, buenos días a todos. Muchas gracias primero de todo por invitarme a la reunión de pacientes con DCP. Yo soy Jorge, soy un chico de 22 años que tengo DCP, síndrome de Cartagener, y he estado trabajando como becario ya más de un año. Precisamente venía a hablar de eso hoy. Voy a hablar de cómo se vive con DCP teniendo un trabajo y cómo es mi rutina, cómo lo vivo yo y bueno, un poco los aspectos a tener en cuenta, ¿no? Entonces, para empezar, os voy a contar un poco cómo es mi rutina. Lo que hago hasta ahora es me levanto por la mañana, me tomo mis medicinas, me preparo, me voy al trabajo. A mitad del día, cuando todos hacen la pausa para comer y se van a comer al comedor del trabajo o a donde sea, yo me tengo que venir a casa, me tengo que hacer la fisio y comer solo y volver al trabajo. Después de trabajar por la tarde, me vuelvo a casa, me cambio, cojo la ropa y me voy al gimnasio. Esto lo hago 4 días a la semana y los días que no hago eso, pues intento dar un paseo o irme a dar una vuelta con alguien para seguir moviéndome. Cuando vuelvo del gimnasio o de dar un paseo o de salir con la bicicleta, llego a casa y hago la segunda fisio que tengo que hacer al día y luego ya pues me pongo a hacer la cena y tengo un ratito para estar o bien con el móvil o viendo la tele y me voy a la cama a descansar. Bien, esto parece una rutina bastante simple, parece una rutina bastante llevadera para una persona que no tenga DCP. Aparte de DCP, yo también tengo una cardiopatía congénita, por lo tanto, para mí es bastante difícil llevar el ritmo que lleva la gente que no tiene nada, ¿no? Bien, yo quería hablar, separar dos facetas que tiene, bueno, la DCP y cualquier tipo de enfermedad, yo creo. La primera es la faceta mental y la segunda es la física. Antes de todo, quería decir que las dos son igual de importantes para mí, eso pienso yo. La parte mental es muy importante. Cuando se trabaja y se tiene DCP, tienes que ser una persona muy constante y tenerlo muy bien metido en la mente, que eso es tu prioridad. Aparte, tienes que aprender a decir que no. Tienes que aprender a ponerte tus propios límites. Y, bueno, pues cuando todo el mundo sigue trabajando y tú estás ya pensando en irte porque tienes que hacer tu fisio, tienes que ir a hacer ejercicio y tienes que descansar, porque también es muy importante, pues tienes que saber decir, vale, hasta luego, y no me importa que vosotros os quedéis 3 horas más trabajando, yo me voy a hacer cosas que son más importantes para mí. En cuanto a la parte física, para empezar, como ya he dicho, es muy importante descansar. La gente no va a tener en cuenta que tú tienes DCP, no por nada, sino porque o se les olvida o no lo tienen en consideración, incluso si lo saben. Y bueno, simplemente tienes que saber decir que no. Tú sí que sabes lo que tienes y tú sí que sabes lo que te cuesta y lo cansado que estás. Al final de la semana, yo estoy más cansado de lo normal, estoy más cansado que los demás y a veces tengo que decir que no. Esto parte de que estamos 8 horas en el trabajo diarias, luego tenemos que hacer nuestras rutinas extras que la gente no tiene que hacer. Otra dificultad es que, aparte de hacer ejercicio, trabajar, llevar tus cosas y cuidar tu salud, también es importante pues, divertirse y hacer cosas y no estar encerrado en casa. Y para esto es muy importante manejar la energía y tienes que saber decir que no a cosas cuando tienes menos energía que los demás y no llegas. Pero también tienes que saber decir que sí cuando no te apetece hacer ciertas cosas, pero son buenas para tu salud. Entonces, la pregunta es, ¿y cómo se hace? ¿Cómo se trabaja? Y a la vez, pues, se lleva uno una vida que no estés estresado todo el rato y que puedas hacer tus ejercicios y tal. Pues yo creo que una de las claves es la flexibilidad en el trabajo. Hay una herramienta que para nosotros es muy útil, que es la herramienta de la discapacidad. Tenemos que llegar al trabajo y ser transparentes, decir desde el primer minuto lo que tenemos y las condiciones que nosotros ponemos a ese trabajo y si no son aceptadas, pues simplemente tendremos que decir que no y vamos a tener menos oportunidades que otra gente en ese aspecto, pero igual hay empresas a las que les conviene también. Bien, por último me gustaría añadir que esta rutina que yo llevo probablemente cambie durante los años, probablemente sea diferente para cada uno y esto es solo mi experiencia y lo que os puedo contar de lo que yo he vivido. Es seguro que cuando tienes una familia, hijos y una pareja, pues se vuelve incluso más complicado tener un balance de trabajo y vida y fisio, ¿no? Pero creo que se puede hacer. Creo que simplemente tenemos que ser muy constantes y muy conscientes de lo que tenemos y de las prioridades que hemos de dar a las cosas. El trabajo es importante, la vida social es importante, pero nuestra salud es más importante.